Hi, everyone, and welcome to the last session of our conference. And we're very excited to have the Louisiana Department of Health, Office of Aging and Adult Services, as well as the Office for Citizens with Developmental Disabilities and Office of Public Health, who will be providing us some updates on some of the services and programs within their respective offices. And you can look at the bios for a complete list of their bios. But I am not going to take up any of their valuable time in giving us some really great information. So first up, we have Mindy Richard, who's accompanied by Elizabeth Atkins, who's going to share about the Office of Aging and Adult Services.
I hope you all are having a great conference, and I hope you've learned a lot in the last couple of days. We're here today to talk with you about the services that we offer through the Department of Health. My name's Mindy Richard. Online, I look like Melinda Richard. That's a nickname that I have. I'm the Assistant Secretary within the Office of Aging and Adult Services. And just to kind of jump right in, what is it that we do within the Office of Aging and Adult Services? We provide access to long-term services and supports for the elderly and adults with disabilities. And, we really focus on making sure that those services are of a quality nature and that we support the participants having a choice in their informal caregiving, and basically the care that is delivered over a person's life is typically a spectrum where it steps, and typically it can get more and more complex as they age. And we want to make sure that you're at the right place on the spectrum, getting the right level of service and having a choice in those services. Those services come to the participants in different ways. And you can see here in this visual, it shows all the different work that we do in the Office of Aging and Adult Services. We have programs that we have a state nursing facility. We have a program for people who've experienced a traumatic head or spinal cord injury. We also have, of course, the adult protective services where when there's an allegation of wrongdoing, we investigate and protect our participants and those that are in our population of served individuals. We also have a branch of our work that deals with supportive housing, where we help give quality housing to the people that may otherwise struggle to get that housing. And of course, the ones you hear so much about are the home and community-based services, and then the nursing facility. We facilitate people going into nursing homes, and then sometimes when they transition out of that nursing home facility level of care back into their home and community. Next slide. Elizabeth, can you advance it? Thank you, ma'am. So some of the services that we provide use the waivers, and I know many of you that have been in this industry for a while are very familiar with the waiver process, but I thought it was good to just kind of revisit some of these steps in that process just to put us all on the same page. So for example, you call this 1-800 number, you talk with our folks about what the long-term options are, what the particular participant situation is, and then based on that conversation, it may be appropriate to request a waiver. And a waiver can be for a community choice waiver, which is the CCW, or our adult day health care waivers. Once that request is put in place, it's actually on a waiting list. And then when the waiting list opens up to be able to offer that individual services, they get an offer that's mailed to them. Once they get the offer, there's some assessment and some care planning that are done. There's also financial determinations are done. And once all that package comes together, then that care plan is approved and the services can begin. And so our team has spent over the last several years a lot of attention in making this process be one that is user-friendly, but more importantly, that it happens quickly so that people can get the services that they need. Next slide. And so Elizabeth Atkins is our program operations deputy assistant in the Office of Aging, and she's going to walk through some of the different types of services that we offer people when they call on that line and we inform them. And she can give you a little bit more information about not just the way, but kind of where those services are offered and how you might participate in those. So Elizabeth, I'll ask you to cover the next couple slides.
Sure. Thanks, Mindy. Hi, everyone. So these on what you see here are the 4 programs that most people call and ask questions about. So we have the Adult Day Healthcare Waiver. There is no wait for this waiver. There might be a wait in some areas of the state depending on where the person lives. So whenever someone requests adult day healthcare waiver, part of that service is going to the day program. Right now, because of the federal public health emergency, there's flexibility to attend or not attend that day program component. But overall in the waiver, when you enroll, you do need to attend the day program. Part of the service is transportation to and from that day program. And to avoid people sitting on a bus for really long amounts of time, we do put sort of catchment areas around the adult day healthcare centers. We don't want anyone to be on a bus or a van for more than 1 hour. So while there's no wait for this waiver, there's no waiting list, it is focused around people who would live within a 1 hour transportation time to the day program. Whenever individuals enroll in adult day healthcare waiver, if that person has long-term personal care service needs, they can also access LTPCS through the adult day healthcare waiver. So the next program is our long-term personal care services program. There's no wait for that service. This is the service that we serve actually the most individuals across the state. And it's very basic, but in a lot of cases, it's exactly what a person needs. It is long-term personal care services in a person's home. There's no wait for this. It is what we call a state plan service. And what that means is an individual must already receive full Medicaid benefits in order to apply for the service. The next program I'll talk about is PACE. That stands for Program for All-Inclusive Care for the Elderly. There's no wait for the service. Right now, we have PACE centers open in New Orleans, Baton Rouge, and Lafayette. And we're working really hard right now to expand PACE. So we'll go into a little bit more detail about PACE in just a few minutes. The final program I'll talk about for this slide is our Community Choices Waiver. This is the waiver that offers the most services, the biggest array of service options. Because it's our most comprehensive waiver, it also has the longest wait. So for individuals on the registry or the wait list for Community Choices Waiver, there's about a 10-year wait for those persons who are also receiving another OAS service. So on our registry, we have some people waiting for Community Choices Waiver, but they're receiving adult day health care. So they're getting some kind of help in the home. We also have people who are on that registry or that wait list, and they're receiving long-term personal care services. So they are receiving some kind of help from our office. For people who have another OAS program, that wait is 10 years, I'm sorry. While it's a 10-year wait, we have significantly reduced the number of people on the registry. We're down to about 6,000 people on the registry for Community Choices Waiver, which is a really significant decrease to where we were in 2017, where we had 30,000 people on that wait list. For persons on the Community Choices Waiver wait list that are receiving no other service, so the person needs help, they're not getting anything from adult day, from Office of Aging, that person has only a 4-month wait for services, which is amazing for Office of Aging and adult services. We've done a lot of work in this area. Our Louisiana legislature, over the last couple of years, we've been provided a lot of new Community Choices Waiver slots. We've been very good stewards of those slots. Every time the Louisiana legislator gives us new slots, we have filled them in the same fiscal year. So we're working really hard to really whittle down that wait and make it as short as possible. So 4 months wait for people who have no other service, and community choices waiver, it is what people want to get the most. I do want to add, because actually Bambi was sharing some information with me earlier today about someone in our community who needs some help, and it made me want to share some information that I think might be really helpful to people. So within our community choices waiver, we are able to prioritize how we hand out those slots. And one of the priority groups are persons residing in a nursing facility. If a person's residing in a nursing facility and they're interested in moving back to the community, but they need help to do it, we can prioritize and give that person waiver ahead of people living in their own home. Years ago, and for many, many years, in order for a person in a nursing home to get a community choices waiver slot, they had to be in the nursing home at least 90 days. And that's what a lot of people are familiar with. A couple years ago, we got CMS approval to change that rule. And since we have a new rule, I wanted to talk about it. Now we no longer have a time frame. What the rule of thumb is, it goes by payer source. So if there's someone in a nursing facility, it doesn't matter how long they've been in that nursing facility. If Medicaid is the payer of that nursing home stay, they can request a community choices waiver. So if someone's only been in a nursing home for a month and they realize this is not for me, Medicaid is that payer source, they can request a waiver. They don't have to stay the full 90 days. I thought it would be helpful information to everyone on the phone. I know a lot of you are advocates and help us by sharing information. So I did want to share that 90-day stipulation is no longer in place. It goes by payer source, and we're looking for people who Medicaid is paying for that nursing home stay. Okay. So Minzy, I'll go to the next slide.
If there's a question in the Q&A, it might be a good time to try to answer it. The question is, if the physically disabled adult has a job, which program would give them an aid to help with at-home care?
Yeah, so that's a really, really good question. So it depends on what kinds of job, and it depends what that person's income is. It might be helpful for us to email offline if you have questions about a specific person, but some people who work part-time who don't have a high income might still be Medicaid eligible, and we can still do a waiver for that person. For individuals that they make too much money from their job to be Medicaid eligible, we do have a state personal care assistance program. And there you go, Kelly. Kelly Monroe, I'm volunteering. Kelly Monroe, they do this work for us. And so Kelly Monroe or myself would be the person to talk with about our state personal assistance program. The state personal assistance program, it's funded through a different source, so you don't have to be Medicaid eligible. So if you make more money, you might qualify for that program.
Elizabeth?
So what we have here is just a visual about our waitlist reduction. We're really proud of it. All of our regional office staff across the state, our program operations team, our research and quality teams have worked really hard. Our support coordination agencies have done a lot of work to really, really reach out to people, help them get services, and reduce the wait list. As you can see, in 2019, which just a couple of years ago, we had 5,959 people on the registry waiting with no other help. Over the years, we've reduced that. So at the end of June, we only had 1,644 people waiting for Community Choices waiver with no other support. Again, this has been done, our Louisiana legislator in 2019 and again in 2021 gave us slots. And this last legislative session, we got Community Choices waiver slots again. So that's 3 rounds. We're really appreciative. That helps us really continue this great work.
Another question, and that is someone who had a waiver but loses it because of high income, would they be eligible for services?
So if someone loses waiver, so in our waiver, so our adult day healthcare waiver, our Community Choices waiver, and our PACE programs, we are able to apply a special income limit. The income limits for those 3 programs are 2 waivers and PACE. It's higher than your traditional community Medicaid. So that we are able to support persons with a little bit higher income through the waivers. If a person makes greater than that special income limit that we allow for waiver, in some cases, there are some spend down options. So the individual pays towards some of the costs to kind of spend down their income. If that doesn't work, then we would encourage the person to apply for our state personal care services program that Kelly Monroe and the team at the ARC helps us facilitate.
Okay, thank you.
I'm sorry, guys, I messed up the slides. Mindy, shall I go into this group too?
Go ahead, sure.
Sure. So we wanted to talk with everyone about our American Rescue Spending Plan. This is a federal funding opportunity available to states to really invest in their home and community-based programs. We have taken advantage of the opportunity, and this is some of the things that we're doing with it. So PACE, again, we're expanding access by adding 2 new sites, and we'll talk about that in a minute. With these dollars, we're able to do increases. We're doing rate increases for our long-term personal care services, our Community Choices waiver personal assistant service providers, our support coordination providers, and our adult day healthcare providers. We're also able to do a rate increase for MIC, monitored in-home caregiving. We're doing that through different funding, but that provider type is also getting a rate increase. With those rate increases, we are asking that the providers funnel, for lack of a better word, a portion of those dollars directly to the workers. We know that the workforce challenges have been really tough for our agencies across the state. And so we're hoping these dollars that we're using from Arpa are really helpful in getting rate increases and bonuses and different wage and non-wage dollars to our workers to really support that workforce. We're also, on top of those rate increases, we're also doing bonuses for workers. So at Office of Aging and Adult Services, those bonuses will be available to your LTPCS, direct support professionals, your CCWPAS, your adult day healthcare direct support professionals, and support coordinators all will be eligible for this bonus. The bonus is $150 per month. Of the $150, $125 goes directly to the worker. So this is an incredibly unique opportunity. 10 years ago, 5 years ago, 3 years ago, I never ever thought that we would ever have an opportunity to just hand bonus money to providers to support the people doing this great work. So I'm happy we've been able to do it. And then we also finally are piloting some new services for our participants. We're doing an access to technology initiative where we will be able to supply a tablet or an iPad to our participant who doesn't have access to virtual technology. And then we're also doing a food as medicine, a medically tailored meal pilot. Medically tailored meals are calorie and nutrition specific meals. They're specifically put together to treat some some health concerns. Diabetes is a good example. Congestive heart failure is another good example. Other states who've done these medically tailored meals have had pretty great results, reductions in hospitalizations, because they're able to provide the person with really balanced, nutritious food. So then here, I'll turn it over to Mindy.
Beth was kind of going over, from a Department of Health standpoint, we're using those, we call them Arpa, the American Rescue Plan Act dollars. We're using those to get money to those direct workers and those folks who are delivering the services, and in a way that makes a meaningful difference and hopefully retains the people that are in those industries. And then secondly, there's technology, and then there's also focus on food. But one of the ways is expanding these home and community-based services through this program known as PACE. And it's an acronym for Program for the All-Inclusive Care for the Elderly. And so the geriatricians really like this program because it is a program that really treats the whole person. There's preventive health care built in. There's occupational therapy, physical therapy, their primary health, all of their acute medical care. Everything is rolled up, as well as these personal care assistants that is also rolled all up in this one program. And right now we have three locations. We have one in Baton Rouge, one in New Orleans, and one in Lafayette. And during this next year, we're going to be adding 2 locations, one in Shreveport and one in Alexandria. And so we're looking forward to having more access to those programs, and really feel like that is a very well-rounded approach to providing the services that people need. And we've heard nothing but good testimonials about particularly families who live within their extended family. It allows the people who need to go to work to be able to manage their elderly parents, for example, in this wide array of services that they might need. So we're excited about the opportunities that are forward. We know that the population of aging people is going to be expanding dramatically over the course of the next several years. So in addition to our disabled adults, we want to build the capacity to be able to meet people on that spectrum of care that I talked about earlier in the very place where they need help, and that they have a choice in the help that they need for themselves. So thank you very much for the opportunity to speak today, and we'll be happy to answer any questions that you might have.
Thank you, Mindy and Elizabeth. I don't see any more questions in our Q&A, but we certainly appreciate the information that you shared. And next, I think we'll have, I see Julie setting up her PowerPoint. And so Julie Hagan with the Office for Citizens with Developmental Disabilities. And Julie, we see the presenter view.
Okay. Any better? No.
No. I think you might have to, I'm not sure how. Maybe,
That's okay. I can just talk. So, good afternoon, everyone. My name is Julie Foster Hagan, and I work with the Office for Citizens with Developmental Disabilities. And I'll share with you guys just kind of a quick overview of our office, and then jump into some fiscal year 22 updates and some headlines for what's coming in fiscal year 23. So our office is a sister office to the Office of Aging, and we work closely with Mindy and Elizabeth. And we share a lot of the same provider networks and support coordination agencies, so we work closely together. So we do have 4 home and community-based waivers in OCDD. We have the New Opportunities Waiver, the Residential Options Waiver, Children's Choice Waiver, and Supports Waiver. And those are operated under our office in collaboration with our Medicaid office. Under OCDD is also our Early Steps program, so our early intervention program here in Louisiana. We do have state-funded services. You'll often hear them referred to as Act 378 programs that we work with the Developmental Disabilities Council on. That is the Flexible Family Fund Program and the Individual and Family Support Program. We also work very closely. Our Office for Citizens with Developmental Disabilities is really the central office that sets policies, procedures. We develop the waivers, the rules, the regulations. We work with the legislatures. And then we have 10 what we call local governing entities or human services districts and authorities across Louisiana. And those are really the boots on the ground folks. They are quasi-governmental entities, but they are responsible for implementing the policies, procedures, and practices that we have in place. And they are what we call our single point of entry. So if you are a person with an intellectual or developmental disability, or a family member of a person with an intellectual and developmental disability, and you need to know where to go for services, kind of your first stop is to reach out to your local governing entity or human services district and authority. So we also have under our OCDD umbrella Pinecrest Supports and Services Center and Central Louisiana Supports and Services Center, and we work collaboratively with them as well. We also have an OCDD Resource Center, programmatic unit, and monitoring unit, which are also folks that are out there on the ground providing consultation and technical assistance to individuals, families, and providers. So that's just a really quick overview of who we are. Now I'll just kind of jump into some updates for things that happened over fiscal year 22, which for us here in Louisiana runs from July 1st, 2021 to June 30th of, July 1st, 2021 to June 30th of 2022. I'll start with some budget related updates. So during the regular legislative session of 2022, we did have some activities related to budget that impacted those OCDD programs I just mentioned. First, I'll talk about dental. So Louisiana is one of the first states in the nation, and we're getting a lot of really positive recognition for this, for adding comprehensive dental services for people with intellectual and developmental disabilities. Right now, that those services are for adults that are in one of our 4 OCDD waivers, or really 3 because Children's Choice doesn't have adults. So in our 3 OCDD waivers, those folks that are there will have access to the same comprehensive dental services that are available to children through our EPSDT state plan service. And that's really exciting. We had a task force, a dental task force through our OCDD State Advisory Council that has worked really hard over the last 3 or 4 years to get recognition for this and to advocate for funding. So we were excited to be able to start this program or this service in July. There was also funding for the being able to provide dental services to adults who live in our intermediate care facilities for comprehensive dental services. And we are in the process of working through implementation on that. Additionally, when it comes to our home and community-based waivers, some provider advocates advocated and were able to get funding added to increase the rate of pay for transportation. So if you are a what we call an ADC or adult daycare provider, for some services you're able to bill for transporting people from their homes to their place of employment or rehabilitation program. And the rate increase allowed for a flat billing of $20 per round trip for those services. So that's an increase. We were also able to continue to receive the funding to allow for rate increases that we had put in place back in October, so that they could continue on for next year. And those are approximately $2.50 per hour rate increase for services that are provided by a direct support professional, with a requirement that a minimum wage floor be paid to those direct support workers, so we could ensure that funding was going to the workers. The budget also included an increase for our intermediate care facilities. There was a per diem. So the intermediate care facilities are paid an amount per day, which is called the per diem. There was an additional $12 per person per day that was added to their rate, with the intention of that being able to go to the direct support workers to help with recruitment and retention of our direct support workforce. We also had when a person is in a intermediate care facility and has to go on leave, the provider was only able to bill 75% of the per diem rate. There was a change that will now allow the provider to bill 85% of the per diem when a person is on leave. And then finally, there was an amount added that was kind of a pot of money that will allow us to give ICF providers a one-time payment. And that is to help with some of the additional costs that those providers have had during COVID. And then the last budget update I'll give you guys is in relation to our Early Steps program. We had several Early Steps providers advocate and were able to get funding to give a 30% rate increase for Early Steps services that are provided. And then an additional increase was given for case management, so that there's now a flat amount that those providers are able to bill per month. That is approximately a 40% increase from where they were. So those are all things that made their way into House Bill 1. We do have, as a department, some additional requirements for reporting. The legislature wants us to give them some additional information about audits and things we're doing to make sure that the money is being spent in the right manner and that money is making its way to the direct support workers. So we will be developing some audits, and then there will be some additional reports that will be sent in. Those primarily go through what's known as the Joint Medicaid Oversight Committee, which is a combination of both House and Senate members who look closely at how we're operating within Medicaid. So the next kind of summary or update I'll give you is just from the legislative session itself. There were a few key pieces of legislation that impacted OCDD directly. There was House Bill 55, which, as I mentioned earlier, there was funding also that went with House Bill 55 so that we could add comprehensive dental services for adults that are living in intermediate care facilities. And so that bill was about that. There was also 3 resolutions, concurrent resolutions in place that ask us to do some studying and reporting of recommendations. So we will be doing that and then submitting reports to the legislature. The first I'll talk about is House Concurrent Resolution 38. That is that asks that we form a working group to look at the needs of people who have co-occurring intellectual and developmental disabilities and behavioral health needs. and look at where there might be gaps and being able to make some recommendations so that we can better support that specific target population. There was also House Concurrent Resolution 39 that asked the department to study and make recommendations for barriers to hiring direct support professionals for persons with disabilities. There was a heavy emphasis on this one at looking at the requirements for a direct support worker having a driver's license, and for some of the criminal offenses that are in place that do not allow workers to, or people to be direct support workers. So we'll be taking a look at that and again, submitting a report to the legislature. House Concurrent Resolution 40 asked that the department study and report on the costs of providing nursing services for folks in waiver and ICFs. So again, that will be something we'll be gathering information. We will be working directly with providers to gather that information so that a report can be submitted to the legislature. And then finally, Senate Bill 260, which is now Act 242, is related to the Community and Family Support Trust Fund. It actually changes the name of that trust fund to the Disability Services Fund, and it established 3 separate accounts so that the way the money comes in, this is something that's called a statutorily dedicated fund. And so there's different ways that money comes in when we sell an OCDD property. So we used to have 8 state operated facilities in several smaller locations. If there was a property that is sold, the funds from the money of the sale of that property go into this trust fund so that it can be used for people with intellectual and developmental disabilities. There was also in the last few years legislation that had a tax related to the sale of medical marijuana and a tax or a fee related to sports gambling, and that there's some additional funding that'll come from those 2 revenue streams and go into this statutorily dedicated fund. So we'll be closely working with our IDD community and partners on spending, and the legislation, this bill kind of directed, gave more direction for how those funds should be spent once they are collected in 3 different areas for spending. All right, so the next area for my fiscal year 22 recap that I'll talk with you guys a little about is COVID and the pandemic. So you guys have probably already talked about this during this time that y'all been together, but our federal public health emergency was recently extended. So that extension goes through October, right now, goes through October of 2022. It is possible that the Health and Human Services will decide to extend it another 90 days. But as of right now, the extension is through October of 2022. So what that means for us, for our home and community-based waiver services, we have several flexibilities and exceptions that are in place. And we've gotten permission for those to stay in place until 6 months after the end of the public health emergency. And so each time that they extend the public health emergency, it extends the length of time that we can continue to have those exceptions or flexibilities in place. And 2 of the main areas that families have expressed concern with us is that during COVID, they have had family members that were previously unable to be paid for providing services who are now able to be paid to provide services. And we have made some changes to our waivers that will be in place even after the public health emergency ends, that does have some allowance for family members to be paid caregivers. We also during COVID implemented the use of some technology, virtual visits, And we've now made changes so that some of those things, not exactly as they are now, but to some degree will be able to continue in the future. You can find a summary of all this on our website, on our OCDD website. It lists all of the exceptions that have been in place, and then all of what the plans are when the public health emergency ends and we get to that 6 months after the public health emergency. We do still have some work to do on defining specific criteria and guidelines that have to be in place related to family as paid caregiver and using virtual visits. And within this quarter, that's one of the things that we'll be working on, is pulling those family groups back together so we can more clearly define that criteria.
Julie, excuse me,
Yeah.
can you move your PowerPoint slides forward?
Oh, they're showing up now?
Well, they've been on the screen.
Oh, I didn't know. I thought I stopped. Okay.
If you don't want to share them, then that's fine.
Oh, that's okay. That's fine. I'm sorry. I thought I stopped. The America, similar to what the Office of Aging talked about, having access to some of additional funding through the American Rescue Plan Act and that Section 9817, OCDD also did some work or was able to receive some additional funding as well. The bonus payments that OAAS talked about, and then the temporary rate increase, again, we did those jointly. So the same thing that's happening for direct support professionals and support coordinators in terms of the bonus payments and the rate increases will also happen on the side of on OCDD's waiver side. We also received funding to contract with the START team, and the START is a nationally known, they're a nationally recognized team that comes in and helps states do an assessment of their state in terms of supporting folks with co-occurring intellectual and developmental disabilities and behavioral health concerns. And so what this contract will do is allow this team to come in that will engage with us, engage with stakeholders, do a full-blown assessment, and then help us make recommendations for how we might update our system to be able to better support those persons. The funding we have also allows us to engage with that team to work on a therapeutic respite model. We have a lot of people who live in the community, but for one reason or another run into issues where they may need some additional help, and that additional help may need to be provided outside of their home temporarily so that they can get stabilized and then go back to their home. And so this pilot program that we're looking to do would work to address finding a place like a respite facility, but providing therapeutic intervention for folks while they are there in that respite facility. So we are working, we'll be working with that team on those initiatives through the American Rescue Plan Act. We also, there's something that CMS allows, which is called a value-based payment model. And what a value-based payment model does, it allows you to states to set specific metrics. And if providers are able to meet the metrics, which means that they are providing a higher quality of services, then you are able to give them additional payments or incentive payments for providing quality services. Our office, right before COVID, was ready to roll out a value-based payment model for OCDD home and community-based services. However, with COVID, it really impacted the metrics we had identified. So we will be using this funding to reestablish our metrics and to identify new targets for folks, but it will still be a way for us to incentivize those providers who are able to meet certain quality targets and quality metrics. Similar to OAAS, we are looking at funding for some remote technology or assistive technology in our system. We know that is a barrier, and so we'll be rolling that out. We do have some work to do to better define that. And then we also have funding for dental training. So we plan to, as I mentioned, one of the things about having the funding and the services available, that's awesome and great. We're excited about it, but we found that there's a lot of folks tell us that trying to find a dentist who's able to provide services to a person with a cognitive disability who may not be able to follow the directions that you would follow at a dentist, and might have extra sensitivities or sensory issues, that a dentist needs to have some special training to be able to provide those services. And we need to find dentists who are willing to do that. So we plan to partner with some folks to be able to provide additional training and offer additional training to dentists so that we can really focus on building the capacity. So now that there's a service there, we need to make sure that we have adequately trained and enough providers out there to provide those services.
Julie, they're saying if you press Shift F5, you could get the screen correct.
Did that work?
But it's okay.
Oh, I did Shift F5 and it's big on my screen, but I think it's not happening on you guys' screen. That's okay. So what's coming in fiscal year 2023? We have a whole lot going on, but I tried to hit the highlights here. We have been working for a while now on a regulation that Center for Medicare and Medicaid Services put out called the Home and Community-Based Settings Rule. And the Home and Community-Based Settings Rule requires that people be integrated and a part of their community. And they have different requirements or ways that states have to make sure that they come into compliance. They've given, I think, 2 or 3 extensions to states for coming into compliance, but CMS has now said that March of 2023 is when states must be in compliance and providers need to be in compliance with the settings rule. There are some new pieces of information that have recently come out, but we will be doing a lot of work and you will be hearing a lot coming from our office talking about getting people into compliance with the settings rule, evaluating where the areas are, looking for any barriers that people have to this final push for coming into compliance. But this is going to be something that we'll be giving a lot of attention to in our office. We'll also be doing a lot of work. A lot of the things that I talked about, the initiatives and activities that we're doing, require us to make changes to our home and community-based waiver. So you do that through something called an amendment. So we will be making amendments to our waiver. We will be, as we work on family as paid caregiver and virtual visits, we'll be updating policies and procedures and manuals. And we're going to just really be doing a lot of work around that this year. We also, Money Follows the Person is a grant that's accessible to states, and OCDD is just one office that uses the Money Follows the Person grant, but there's been an extension of that. And so we thought it was a program that was going to go away, but there's now some longer term funding and opportunities. So we're really refocusing on that. And Money Follows the Person is an activity that helps keep people out of institutions, either for them to be able to move or for them to be able to stay in the community. And so it's a good opportunity for funding to help support that. We'll also be doing outreach activities. It's really important to our office that we be as transparent as we can. When you have to work within the guidelines and the regulations that we do, they're very complicated. And so we are committed to trying to break that down so that folks can understand our system And we are really committed to trying to make sure people know what's out there and what's available in the system and where do they go. So we have continued outreach activities planned so that we can make sure that we're informing and educating folks about our developmental disability services system. And then our early steps program, every year we engage in a statewide improvement plan, and we have many activities we work on directly with our state SICC on those activities. And so we'll continue to do those in 2023. If you have questions, I think I have a couple of minutes that I can answer any questions folks have. If you ever have questions though about your own individual situation or need guidance on where to go, we do have a general OCDD email address that's checked multiple times throughout the day. So I've included that there. It's OCDD info, capital INFO, @la.gov. And you can send emails there, and we have staff that check it and will direct it to the correct person who can answer your email. I've also shared with you my name, title, and my contact information as well. All righty. So do I have any questions, Bambi? Oh,
I'm going to ask if you could go, which you just put the slides down, but to see if you could show the recap slide for the legislative slide. Sure. Because it wasn't shown.
I'm sorry. Try again.
But also, if you guys could also send me the PowerPoint, I'll link it in our document where we're collecting everything. That way people can.
Can you see it, Bambi?
Yes. I mean, it's kind of small, but I could see it.
So yeah, I can send it to you.
And then do we have an anticipated date for the DSWs to get payments?
Yes, we are. So we're hopeful, and Elizabeth, I saw you come back on. So we're really, really, really hopeful we can do it by October the 1st. Just so folks understand, we've been programming, we've been working to get the system programmed. What will happen is if you're a provider agency or a support coordination agency, you will get a spreadsheet with the names of all of the staff and the months that they worked, and so that it will be very clear. We also are working, if you're happen to use self-direction, with the 2 fiscal intermediary agents we have to make sure that the direct support professionals in self-direction will receive the bonus payments. And then we have to make this system talk to this system, and then we do run a test. If we run the test and everything goes great, then boom, we can start it. If we run the test and something doesn't go right, we have to go fix it and then run a test again. So we're in the process of doing the testing, but it just depends on how long it takes us to kind of get it right, because we don't want the money to go out incorrectly. So we're trying really hard to make sure that we get that straight. But we are unless we run tests, unless we run into major issues with our testing, we're hopeful that it will be able to start by October 1. Elizabeth, I don't know if you have more detail than I might that you would want to add.
No, that's the next phase for us to work through. We've once CMS approved our Arpa spending plan with this request, we had to turn around and do Appendix Ks to get it in our waiver amendment. So we've done that. We had to do a emergency rulemaking, so we've done that piece too. So there's several steps that we've completed, but Julie, I mean, you said it beautifully in terms of this systems. We've met with our partners with the EVV system. That's where a lot of information is going to come from, and Gainwell and Medicaid to talk about the how. Now we need to practice it and test it to be sure it goes as smooth as possible.
Do you want me to just keep going with the questions, Bambi? I've got them open now.
Okay, well, I can read it for you.
Okay.
How much is one-time supplemental payments for ICFs, and is the payment per provider or per ICF?
Sure. So The ICF providers received a one-time payment, maybe a year and a half. It's been a bit. What happened was there was one lump sum amount that was added to House Bill 1. I believe it was around $30 million. What Medicaid will do is take a look. They call it utilization. So they say, this is how much the ICF provider billed across the course of a year. And so they'll do that for all ICF providers. So they see what percentage of the amount that was billed by each provider. They then take the total amount that we have and then divide that out using those same percentages. So it will be based on the billing that each ICF provider did, and it will be a percentage of what the total is. Hopefully that was clear. I'm not a math person, so I don't know that I explain it all the way great, but basically take the lump sum, divide it out for all ICF providers, and the percent you get is based on the percent that you billed in the last fiscal year.
So the next question, I believe, apply to both OCDD and OAAS, is any plans to address the DSW shortage that has now been exacerbated by the pandemic and higher competitive wages in the private sector?
I'll start, and then if you guys want to jump in. So, you know, the bonus payments that we're doing now, the rate increases that we are doing now are all really geared at the ICF increase. They're all geared at recruitment and retention efforts for direct support providers. In fact, the language in House Bill 1 made it clear that legislators wanted to make sure that you know, the majority of the rate increases were making their way to the direct support workers. We also have other initiatives. I believe that the rate of pay is very important. I also think that there are other things that are also important that we consider. And so there are plans, and that is within OCDD, we are working, and we have kind of a group that we meet with regularly to take a look at what are some other things other than rate of pay that might be beneficial. And we're paying really close attention to what's going on the national landscape. There's a lot going on about the direct support workforce crisis that they're trying to do at the national level to get some additional resources. So I'll stop there, Mindy. I don't know if you want to add.
From our point of view, the new rules that we're putting in place will marry what happened last year with OCDD, and that there will be a $9 minimum floor for the wage for those direct service providers. And they are the direct service workers, and that's taken out of those rate increases. And then in addition to that minimum amount, 70%, like Julie said, and in order to meet the spirit of what the legislators wanted to have happen, 70% of those rate increases will need to go to the workers, and they can go in non-wage formats. And so we're given some approved ways, whether that's sick pay or benefits of some kind. And we'll have a list of things that we've already pre-approved, but if a provider has some other ideas of what might be an incentive for their workers, we're willing to review that and approve that as well. But the bottom line is that, you know, we're making that investment using those ARPA dollars for 70% of those increases to go to the workers themselves. And so we have done the emergency rule. It's in its final stages, and then that will be going out to the providers as a communication, and then we'll be doing auditing on the back end to review those payrolls and to make sure that what we wanted to have happen actually did happen and make it into the hands of the right people. Elizabeth, is there anything else you would like to add to that?
Thank you.
Another question is, will the entire $30 million be spent by giving those one-time payments? If not, what happens to the balance?
Yeah, and I was trying to turn around and see if I could find my House Bill 1, and I don't see it. But yes, there's a specific amount that was added that was dedicated to that use. And so that is the total amount that is being calculated to then be distributed. So yes. And the entire amount, I just can't remember the specific amount, but that entire amount that was allocated in House Bill 1 will be distributed across ICFs.
And then I'll take the second question. It says, I keep losing my DSW because of benefits. Is there any plans to add health insurance coverage or other incentives like sick pay or vacations? So that kind of speaks to that non-wage option that we're giving the providers. So those 70% of the money has to go to the worker. So if they're already paying a $9 a wage and they don't want to go up on the hourly wage, they have to use that money in other ways. And one of the ways they will be approved to do so is with benefits. So we do find that that's could be a real incentive for the workers. The other thing I would mention on this, we haven't really called it out specifically, is that we keep talking about these ARPA dollars. And so we are going to be doing these rate increases and paying these, insisting on these wages that go to the workers until that money is gone. And then we will be, our plan is that we hope to demonstrate by the use of these dollars how much that investment really benefited our industry. And through that, our plan is to ask legislation to basically continue that, to support it on, because these are what we would consider one-time dollars. They're not an investment forever. We have a limited amount of time to spend and a limited amount of money that we can use. So we hope to do really good things and really document the improvements so that we can make a case for why we need to continue those. But we may need some legislative support in that case. Okay, let me see another question. Is it only through providers, or can self-direction participants partake in the benefits for their employees? Elizabeth, I think I might have to ask you to help me on that one. I don't think that there's an avenue for if you're not a provider. Is that correct?
Right, right. For self-direction, there's not a mechanism for us to be able to do that. So it's your typical business community licensed provider type.
And that is all the questions that I see for you guys. So, and it's just about the right time. We have Office of Public Health that will be sharing some information, and Jana Broussard will be presenting on behalf of the Office of Public Health. So Jana.
Hi, good afternoon. Can everybody see me? It's a little
Yes,
dark.
ma'am.
Okay, I will apologize in advance. I'm in the midst of a pretty intense thunderstorm, so I'm just hoping that my internet connection stays on for the duration. My name is Jana Broussard. I'm the interim executive director for Louisiana Commission for the Deaf, which is housed within the Office of Public Health, Bureau of Family Health. And on behalf of the Office of Public Health, I will be sharing some resources about some of the programs that are within the Office of Public Health. Let me see if I can share my screen. Let me see if I can not do.
Yeah, we're seeing just kind of your full screen.
Okay. What am I trying to do? This one. Is it good now?
Yes, it is.
Okay, great. So hope everybody's having a great day. Again, this is some programs, services, and information related to Office of Public Health. Office of Public Health has many programs within it. And so in order to be able to provide kind of a comprehensive report, we chose to take an approach of basically letting you know what is available within the Office of Public Health. And then some of the programs I will elaborate on a little bit. Again, I am representing quite a few other programs that I don't work directly with. So I will try my best to answer any questions you may have. However, I may be a little limited, but can certainly point you in the right direction. So just as an overview, reminder, the Office of Public Health's mission is to protect and promote the health and wellness of all individuals and communities in Louisiana. And they accomplish this through education, promotion of healthy lifestyles, preventing disease and injury, enforcing regulations that protect the environment, and sharing vital information and assuring preventive services to uninsured and undeserved individuals and families. So the relevant programs that I really want to highlight today are two, namely programs and services for children and youth with special health care needs. And there is a large list of programs underneath that category, and then also with the Louisiana Commission for the Deaf. So the programs and services for children and youth with special health care needs works to ensure that children and youth with special health care needs in Louisiana have access care services designed to minimize their disabilities and maximize their probabilities of enjoying independent and self-sufficient lives. Also, the Louisiana Commission for the Deaf specifically provides programs and services to people who are deaf, deafblind, and hard of hearing, and also resources to ensure full communication access to the world around them. LCD staff work closely with community members and other stakeholders to continuously improve programs and services to meet their needs. And I will explain a little bit more about both of those in just a moment. So on this slide, we have just a comprehensive list of some of the programs that are underneath the Children's Special Health Care Services, to include supportive services for children and their families, specialty clinics and parish healthcare units, genetic disease program, the Louisiana Birth Defects Monitoring Network, newborn screening program, the Early Hearing Detection Intervention Program, the Louisiana Sickle Cell Commission. Some of these we'll highlight today. And then also underneath the Louisiana Commission for the Deaf, there are 4 programs there. And again, these are specifically related to individuals who are either deaf and blind, or hard of hearing. And we have a telecommunications equipment distribution program that provides amplified equipment and alert systems at no cost. We also have a hearing aid program that is for eligible seniors ages 50 and up, and that also meet a specific income requirement. The interpreter program that we have, which I will talk more about later, has to do with communication access on a limited level, just depending on areas in which maybe the Americans with Disabilities Act doesn't apply. But mainly the focus within our interpreter program is workforce development and support, along with ADA support. And then the 4th program is a support service provider program, and that is specifically for individuals who are both deaf and blind. And those programs provide one-on-one support to provide visual and auditory information for individuals. And also the goal is really to empower these individuals to fully participate in their communities. So going back to the top of the list, just for a moment, the Children's Special Healthcare Services Clinic is within the Partners for Family Health. And that clinic ensures that Louisiana children with special healthcare needs has access to healthcare services to minimize those disabilities and maximize the probability of independent and self-sufficient lives. That is accomplished by ensuring 3 things, as you can see on your screen. The first is enrollment in healthcare insurance coverage and access to a medical home and care coordination for all of the patients in order to meet the multidimensional needs of their family. The second is that all the clients receive behavioral health and nutritional assessments and appropriate referrals as needed. And third is that patients age 14 and above receive transition to adulthood planning and readiness assistance. Within that program, there is also a transportation sector, and this program provides needed transportation assistance. Oops, I think I clicked too far. For eligible families of children with special healthcare needs to attend medical appointments or procedures, go to the doctor, stuff like that. It's important to note, though, that families have to seek transportation assistance through their managed care organization before requesting the assistance through the Children's Special Health Care Services. Just has to go through the MCO first. For more information about that, you can contact the Family Resource Center or your local Families Helping Family Center for more information about the transportation option. Another program is the Genetics Clinical Services, and that program's purpose is to operate a comprehensive newborn heel stick screening program, which is in order to, it's important that they meet those national standards along with all of the screening, and also to ensure access to genetic evaluation and counseling to all residents in the areas of Louisiana after any diagnosis is found. The Louisiana Birth Defects Monitoring Network is legislatively mandated to identify children diagnosed with a qualifying birth defect by their 3rd birthday. And so these birth defects include specified major structural or functional abnormalities of the, let me see if I can read this, central nervous system, ears, eyes, heart, craniofacial, etc. And they all follow the Centers for Disease Control and Prevention and National Birth Defects Prevention Network guidelines and standards for data collection and reporting. So they had some updates they wanted to share with you in SFY, which is like the fiscal year of 2021, which is July 21 through June of 2022. They identified strategies to improve efficiencies and timeliness of case identification, data collection, and the availability of reportable data within 24 months of delivery. Then in SFY 22, so the following year, they piloted and successfully implemented those strategies and were able to improve efficiencies to meet the national standards. In SFY 23, which is where we are right now, starting in July of this year, they will move the data to action beyond just the reporting. So that's their goal for this year. To that end, they are implementing 2 projects of particular interest to this conference. One is a referral project and a development of a case review model for birth defects prevention. So in partnership with the Bureau of Family Health's Title V Family Resource Center, that data is going to inform one-on-one needs assessment with families and referrals to services for children with birth through age 2 who may benefit from some of these early intervention options. The staff is going to contact families to screen and facilitate those referrals to resources, including health and insurance, disability agencies, food security, childcare, et cetera. You can kind of read them on the screen. And in partnership with the advisory board, they're developing a birth defects prevention case review model. And the purpose of that is to move the data, like I said, to action by identifying preventable birth defects and make evidence-based recommendations for systems level change in order to improve the prevention and intervention efforts in Louisiana's maternal health system. Next on the list is the Early Hearing Detection and Intervention Program, also known as EDI, and that is within the Bureau of Family Health. And their goal is to engage, educate, and train health professionals and service providers about screening recommendations that are evidence-based, the benefits of a family-centered medical home, and the importance of communicating accurate, comprehensive, up-to-date, and evidence-based information to those families to help facilitate the decision-making process. And next is to facilitate improved coordination of care. So first is like the detection side and the intervention side of what they do. The coordination of care and services for children and their families through the development of mechanisms for formal communication, training, referrals, and data that's getting shared between EDI and Individuals with Disabilities Education Act, IDEA program, and the program for infants and toddlers with disabilities, Part C program. So these are the kind of the goals or the purpose of the EDI program. How am I doing on time? Oh, wow. Give me 1 second, sorry.
17 minutes.
Okay, so the Bureau of Family Health offers a family resource center, and this center is kind of still in its early stages of being developed. However, it is the hope is a very comprehensive place that families can come for referrals to additional resources as they need. And the Family Resource Center is collaborating with the Louisiana Birth Defects Monitoring Network on a pilot to help them outreach to the families that are identified. So if a family is identified, then the Family Resource Center will be able to get in touch with them to be able to be proactive on helping them find the resources. BFH completed a first cohort. It had 261 families and will launch a second one in August, so next month. The preliminary data demonstrates that of the 261 families that were outreached, over 142 of those families completed a needs assessment, and 132 were able to receive that resource information. So this is a little bit more about the screening initiative that's part of the Bureau of Family Health's Title V Maternal and Child Health Network. I could stop pressing the button too quickly. And this initiative aims to improve early detection of any developmental delays and disabilities in children. And they do this by promoting comprehensive development screening standards in pediatric primary care, and also early child care for children ages 0 through 5. So in addition to the early childhood screenings, the work also focuses on maternal and caregiver depression screening in pediatric settings for children who may have been early identified. So when a providers screen and identify needs and concerns when they occur, the children and families can receive their critical referrals and follow-up care that they need for their child and their family to thrive. This is a very important project. Additionally, this going similarly still with the developmental screening guidelines is that the Louisiana developmental screening, the Bureau of Family Health, promotes this screening to provide recommendations on screening tools and recommended screening intervals. And the guidelines also align with national recommendations for autism, developmental milestone, and perinatal depression screenings. It also includes recommendations for social and emotional development and social related health need screens. They've also developed this really cool toolkit that is now available online to help medical providers kind of integrate developmental screening services into their day-to-day practice. The virtual toolkit uses a quality improvement framework, which allows providers to systematically improve the way healthcare is delivered to families they serve, and that is through instructional videos and downloadable worksheets. They also have customized trainings to meet provider or clinical needs as available, and this is available at no cost to the practice through the Title V initiative. And down at the bottom, you can see there's actually a link that is within the LDA developmental screening toolkit. And you can specifically ask for customized trainings by contacting Dr. Tressa Northington, and her email is provided on this slide here. So some other important resources that I'm not going to go into detail about, but I did just want to go ahead and mention within the Office of Public Health is the Louisiana Healthy Homes and Childhood Lead Poisoning Prevention Program, and that is geared towards eliminating childhood lead poisoning in Louisiana. The other one is the Reproductive Health Program, and that is, and they hold the federal Title X grant, and that aims to reduce female and infant mortality, morbidity, and teen pregnancy by providing disease screening, health education, counseling, contraceptive methods, etc. Another one is the Emergency Medical Services for Children, and that is an initiative designed to reduce child and youth morbidity and mortality caused by acute illness or injury. The next one is the Adolescent School Health Program, and they facilitate evidence-based quality improvement in Louisiana school-based health centers. They provide information, technical assistance, direction, etc. And their big focus is collaborating with obviously schools, healthcare providers to provide and reduce disparities and encourage healthy transitions from adolescence to adulthood. Okay, and then last on the list is Louisiana Commission for the Deaf. So all of these programs are kind of all within the Bureau of Family Health, Office of Public Health. And so the Louisiana Commission for the Deaf's mission is to engage, empower, and enrich the lives and opportunities of Louisiana deaf, blind, and hard of hearing people. Last year, there was a vote to establish strategic priorities up through 2024. And those priorities include enhancing community engagement. So LCD is going to enhance its engagement with the citizens of Louisiana on relevant issues. The goal is to do that through robust and accessible communication platforms and strategies to really get the information out there to individuals who may need it. The next on the list is to modernize the telecommunications access program, which I mentioned earlier. That's the amplified phones, alert devices, these types of pieces of equipment for deaf and deafblind individuals. The goal is to modernize that program, ensure that the equipment that is being carried currently is modern, is up to date, it's beneficial, and also, to review some of the internal processes of that program to see if there's some more, better approaches, more effective and efficient approaches that we can install into that program. The next one is addressing gaps in mental health services. So there's a very large disparity along the deaf and deafblind population within mental health services, and LCD is committed to collaborating with agencies and organizations to advocate for the increased number of signing and culturally competent mental health professionals and systems that are designed to be inclusive of this population. The next priority is addressing racial disparities in LCD services. So LCD will increase engagement and representation of people of color to be involved in the decision-making processes related to state and LCD services provided through the community. And they commit to do that through audits and assessments and strategic initiatives to mitigate the disparity, in the provision of services and ensure equitable distribution among the demographics. Whoops. Next on the list is one of the most important ones that we want to highlight, at least for today, and that's establishing interpreting standards and systems. So LCD voted to establish new systems and standards for American Sign Language interpreters in the state. And this is to define, describe, and incentivize new expectations for that workforce, and then also to provide oversight of the quality of interpreters, including those working in educational settings. So what LCD did to kind of take the first step in that direction is proposed SB 98, this legislative session, which is the statute, SB 98 was revisions to the statute that authorizes LCD to collect money and spend that money on behalf of this population. Part of the revisions was a significant language change around what it meant for LCD to provide support and oversight for interpreters. And so there's a few points that are highlighted here. I just want to make sure that we're really clear on that LCD is not going to be certifying interpreters. So we're not actually doing the screening process in order to base that qualification or rate their qualification, but instead we're going to establish the standards and minimum qualifications for those interpreters. So, perhaps the LCD says you have to have X, Y, and Z to be able to work in the state of Louisiana. So LCD is now working towards looking at those minimum qualifications, what they should be. In order to do that, there's some rulemaking that's going to have to happen. So SB 98 is now Act 128, and I do believe is effective as of August 1st, so just next week. And so some of the definitions and the kind of details surrounding interpreters will be going into rule, not necessarily our statute. Part of the process, though, in ensuring that minimum qualifications can be reached is LCD committed to providing training and other support for interpreters, whether that's through higher education opportunities, workshops, mentoring programs, et cetera. Some also kind of significant pieces of that language within SB 98 was a partnership with the Louisiana Department of Education and also the Louisiana Supreme Court for interpreters that work in those particular sectors. So in educational setting, the demands and the requirements and the role of an interpreter in an educational classroom look very different in some ways than someone who works in a community setting, who works in a hospital setting. And then similarly for the Louisiana Supreme Court, a lot of nuances that come with legal work, that the interpreters have some kind of additional work they have to do in order to be qualified to work in that setting. So to be able to move all of this forward, Louisiana Commission for the Deaf has contracted with NIV Strategies, which is a deaf-owned consultant company, and they're providing a comprehensive statewide interpreter assessment that actually began in March. and is going through December 2022. That's this year. And the purpose of this assessment is to conduct a high-level comparative assessment of frameworks in other states. So like trying to figure out what are other states doing, how are they monitoring, are they providing licensure, are they doing certifications, what are they doing with the interpreter workforce in their state, and what was the framework that they used to kind of get there. Another key point is to gather just data from stakeholders or on the expectations for interpreter standards. You know, what does that mean? Like, you know, what is it that we need? Like, what is the current state of Louisiana at this point? The next point is to provide an analysis on the potential paths forward. So, you know, they may come back and say, here, you know, here's two options that you have that based on our assessment, we feel like this would be the recommendation on how you should move forward. They're also going to provide the implications and impact of each one of those paths. So that's going to be very helpful in communicating to providers, to deaf individuals, to interpreters. If we were to go in this direction, here's kind of the pros and cons that you can kind of expect. Impacts or implications as we move forward. And then lastly, it will come in a very comprehensive report with recommendations for a multi-year implementation plan. So this isn't something that is going to be able to happen overnight. Obviously, whenever you modernize and standardize a workforce requirement, you know, that is something that you really have to take your time on and want to do it right and do it well. So it will be a multi-year process. So real quick, because I know we're almost out of time and I do want to leave a few minutes for questions. There is one more thing that LCD wanted to make sure you're aware of. HCR 80 of 2019 provided for a study group to discuss communication access in healthcare settings for individuals who were deaf, deafblind, and hard of hearing. And part of the recommendations that came out of that study was that that the LCD should work with the Department of Health and adopt best practices. Like at a minimum, we need guidelines, we need help. You know, people don't necessarily know what they don't know. So we have been contracted with another consultant who is working on that. And that, as a matter of fact, will be ready. It should be in the next like 4 weeks or so. So I would say early September. But really the goal is to promote health equity, you know, through evidence-based best practices and equitable programs, services, and operations. So it's really addressing effective communication in healthcare settings and understanding that communication equity and access is health equity and access. So we're really excited about this best practices. There's going to be a guideline book, and then there's also a handbook. So the guideline book is very, very deep, very long, you know, kind of detailed. And then the handbook is more kind of like tips and best practices for individuals moving forward. We do plan to follow that up with some training and webinar opportunities. So if you're a provider or a family member who works, you know, with these, you know, with deaf or hard of hearing people in medical settings or assisting your child, and you want to know more about what your rights are or how to best provide effective communication access, these trainings and webinars are going to be a great opportunity for you. So I will stop sharing my screen and if I could find it and take any questions.
Thank you so much, Jana. I do not see any questions. I guess you did such a great job of wrapping up our conference. We really.
Oh, my last?
You are.
Well, yeah, thanks for hanging in with me then.
So I just wanted to thank you, Jana, Mindy, and Elizabeth, and Julie, all of you guys for just sharing that information about these programs within the Department of Health. Also want to thank our interpreters who have done an excellent job throughout the conference. We really appreciate and value them. And want to thank everybody who has participated. We had over 700 people who registered for the conference and over 300 people each day that participated in our sessions. So we hope that you guys have gotten as much out of it as we have. And lastly, I want to thank our staff who this would not go so smooth if they didn't put in a lot of hard work over the past months. And so that is Jordan Briscoe, Alicia Vaillant, Lillian Dejean, and I also want to thank William Romero, who is our governor's fellow over the summer. He'll be leaving us next week. And I said that was lastly, but that wasn't lastly. I also want to thank all of our presenters. No one was paid to be a presenter or to be a panelist. Everyone just volunteered their time and talents to this conference every year. So we really do appreciate it. And I think it was an excellent conference. So thank you guys, and have a good rest of your day.